Bruce know that it exists. So, in any event, if you have questions, do put them in the chat, and he's going to leave time for questions at the end. He's been a wonderful doctor in this community for years, and we're very fortunate to be able to snag him to talk today. Bruce Kessler received his MD from Columbia University over 50 years ago and did his internal medicine residency at Stanford. He practiced general internal medicine in Humboldt County for over 40 years until retiring from his practice in 2018. He was the chief of the medical staff of both Mad River Hospital and St. Joseph Hospital, and in 2023 received the Plessner Award from the California Medical Association, given annually to the California physician who best exemplifies the ethics and practice of a rural practitioner. He was involved in starting the local family medicine residency program and has been on the boards of several medically related local organizations. And Bruce, welcome. It's now all yours.
Thank you. Let's see if this works here. Okay.
There you go.
Okay, there we go. So thank you, Jane, for asking me to talk today. This is a topic that I think all people in my age group in this community, and probably some younger people, are very concerned about, and that is access to medical care. Whenever I meet with my friends and the people in my age group, the conversation very quickly will go to your latest medical complaint. And the reality is, if your primary care provider retires or leaves the area, it's very difficult to find a replacement. Long wait times are the norm, and specialty care is often not available locally and requires traveling. So the question I'm going to try to answer today is just how bad is the situation we have? And is it any different than that in the rest of the country? Is there anything that can be done to improve it? Last May, Senior News decided to devote their entire May issue to the issues of healthcare, and I was asked to write the lead article. Dr. Jack Irvine, who was my partner for many years, and I were reminiscing of what we thought was the golden age of medicine in Humboldt. We thought back to 20 years earlier, like 2005, when it seemed like we had enough of most specialties here and most primary care physicians. And we wondered, is it just that our memories were fading as we're getting old, which probably is truth. But we decided to try to document it. So we asked the secretary of our local medical society to lend us the directories for over 20 years, 2005, 2015, and 2025 directories, and just tallied up the numbers. And as we expected, the results showed a dramatic decline across the board in almost all specialties. In preparation for today's talk, I asked Amanda, who's our medical executive secretary, to give me the first edition, if you will, of the 2026 directory and tallied up the numbers. Now, I don't expect you to be able to read my chart, but you will notice in the right-hand column a lot of red ink. Those numbers represent the decrease in physicians in different specialties over the last 21 years. This chart, Ted Pease has assured me, will be printed in this May's edition of Senior News, so you'll be able to see the details yourself, and I'll cover it in my talk today. Just a few caveats on how we did this survey. These numbers only represent 4 points in time in a continuum. You know, doctors come and go all the time, and if I were to do, try to add things up today, the numbers would be a little different than they were just a month or two ago. But the trends are the same, and the trends are, incontrovertible that there's been a decrease across the board. We counted not only members of our medical society, but non-members as well. We did not count locum tenens physicians, which are now a very important part of our medical workforce locally. A locum tenens physician is a physician who lives elsewhere who agrees to come here for some period of time, maybe just a week, it may be a month, and maybe several months, but they're not planning on staying here long term. We also excluded telemedicine physicians, which have become also an important part of our healthcare delivery system. We excluded doctors who were no longer seeing patients, such as Candy Stockton, who's doing a great job as our county health officer, but no longer seeing patients as a family physician. And we only counted the doctors who were in what I call metropolitan Humboldt County. If you will, the area from Rio Del to Trinidad. We didn't include Southern Humboldt, Hoopa, or Del Norte County. So with that being said, I'm just going to start off with a chart here of physician workforce by specialty. So you can see the trends. The top line are primary care physicians, which have gone from 111 down to 71. The next line down, the purple line, are basically hospital-based physicians, which include hospitalists, emergency room doctors, and radiologists. This is the only group that the numbers have actually increased. 20 years ago, most patients in the hospital were cared for by their primary care physician. Sadly, to my way of thinking, that's no longer the case. Hospitals take care of people in the hospital. The orange line are surgeons, which have gone to both general surgeons and surgical subspecialists, where we now have half as many as we had 21 years ago. Although that number has stabilized over the past year, there's actually been one increase. The green line are medical specialists, anything from gastroenterologists to medical oncologists that have dropped by about a third. And the most dramatic drop, although it may not look like it, is the blue line on the bottom, which are psychiatrists, which have gone from 17 down to 4, or a greater than 75% decrease over the last 21 years. Now, I'm going to go over some details, and I want people to ask questions, but I'm going to ask Jane to hold the questions. I'll have a few breakpoints, but please raise your hand on Zoom or put your questions in chat so we can discuss some of the things as we go along. So here are the numbers for primary care physicians, which are both family physicians, general internists, and pediatricians, which have dropped by over a third from 111 to 71. The most dramatic decrease for general internists, which have gone from 22 now down, sadly down to 4. So the specialty that was what I did for 40 years in our community is almost no more, which I think is very sad. The trend is especially concerning if you lose your primary care physician through retirement or relocation. It's taken a long time to get a replacement. And 1 year ago, when I did my article in Senior News, there were actually no primary care practices north of Fortuna who would accept new patients with Medicare or private medical insurance. And if you don't have a primary care provider, your only access to the whole healthcare delivery system is to go to the emergency room, which is certainly the most expensive place to get your care, and generally not the most pleasant either. Now, we hear in the news that there's been a shortage of doctors all over the country, and rural areas seem to be worse than others. So the question I guess you should have is our situation really any different than those of other rural communities? Well, I tried to get some accurate information on this and found that the University of Wisconsin School of Medicine actually has a website called County Health Rankings and Roadmaps, where they actually look at every county in the country and give all sorts of health information. So if you're interested in more information on this, I really would urge you to go and look at their website. It turned out that they updated their information just last week on March 25th. So here's a bunch of counties in California, and what they listed is patients per primary care physician. Now, oftentimes we would consider this a primary care doctor's panel, or the number of patients that they are responsible for caring for. Generally, the lower the number, the better, because if a doctor has fewer patients that they're responsible for, there should be a shorter wait time to get to see them. and more time to spend with their doctors. Well, not surprisingly, Marin and Sonoma are much better off than we are, with Marin having almost 3 times more primary care providers per capita than we have. I don't think anybody's really surprised at that. That's where the money is. The state of California, the ratio of doctors to patients is 1,200 patients per primary care physician. If you look at Humboldt down, I highlighted in yellow, we're 1630 to 1. Now, I looked at some other rural counties to see how they fare, and Mendocino, Shasta, better than we are. Even Del Norte is better than we are. And I was very surprised that Modoc County, which some of you may know, is at the far northeastern corner of California, with Alturas as its county seat, actually has more primary care physicians per capita than we do. Butte County, a little worse than we are. And Trinity County, they are really hurting. They have only 2 primary care physicians for their 15,000 patients in Trinity County. So just think of that the next time you're driving to Reading. Now, the good news is that in order to maintain access to primary care services, the major providers of primary care in our community have ended up using more advanced practice clinicians, which are nurse practitioners or physician's assistants, to maintain access to primary care. Now, I'd like to argue that primary care practitioners and primary care physicians are not the same. I've worked with some wonderful nurse practitioners and physician's assistants over the years. Some are good, some of them are actually great. But the reality is it only takes 2 years of formal education after college to become a PA or an NP. Whereas whether you're becoming a family physician, a general internist, or a pediatrician, you have 7 years of formal education before you're released to the world, if you will, and can get a license. That includes 4 years of medical school and 3 years of residency. The reality is that APCs do a great job caring for healthy people with acute intermittent problems. However, when they're confronted with more serious, complicated medical issues, their reflex is to turn to specialists because they feel they aren't trained to care for that level of complexity. And this works well in a community that has plenty of specialists, but sadly, that's not the case for Humboldt. APCs also, there's data that shows that they tend to order more laboratory tests and imaging studies than MDs, which is not surprising because they oftentimes don't have as much confidence to make clinical decisions without that evidence. And that increases the cost of medical care, which somebody's paying for. So what's the good news? Well, a year ago, there were almost no primary care practice willing to take new patients with Medicare insurance. But now, in March of this year, the situation is much better with many offices accepting new patients. But the situation is incredibly complicated. I spent some time the last few weeks researching what the situation is in different practices. And I'm going to go over in the next bunch of slides to give you some details. But, it's so complicated, I would suggest that if you're interested in joining any of the practices I'm mentioning, you need to contact them yourself. And as you can see, availability to be seen often depends on who's paying the bill. I'm going to start off with Open Door. Open Door is an FQHC, or a Federal Qualified Health Center. These were established as safety net centers to basically take care of people without any other providers to care for them. But here in Humboldt County, they're the largest provider of primary care, including patients with private insurance. They have offices basically from Fortuna up to Crescent City and in between. All of their offices are open to patients with Medicaid, which in California is known as Medi-Cal, and it's administered locally by the Partnership Health Plan, because that's what they were established to care for. Open Door Clinic is also willing to see pediatric and obstetric patients regardless of payer type. So if people are covered by private insurance or even Medicare, and you say Medicare, pediatric patients, well, if a kid is disabled, they may be actually eligible for Medicare because they're disabled. None of the open door clinics at all are open to new patients with private insurance, including people that have California Care or ACA or Obamacare plans. Now, the good news is that if you're an established patient at Open Door and you established years ago, they haven't dumped you. But if you are a new patient wanting to get in and you have private insurance, currently they don't feel they have adequate capacity. Some of their clinics will take new patients with Medicare as primary insurance, including Ferndale, Eureka, Willow Creek, and Del Norte, but not the clinics in Arcata or McKinleyville. The second largest provider of primary care locally is Providence Primary Care, which has two offices, one on Harrison Avenue across from Ramones, and the other one in Fortuna. Last year, they were not taking any new patients, but this year they've opened up because they've hired several new APCs, and there are both several physicians and several advanced practice clinicians that are seeing new patients with private insurance as well as Medicare. They do not accept Medi-Cal patients. I guess they figure they can be seen at Open Door. They request that if you want to be established in their practice, you should come into the office, pick up an application packet, and fill it out. I'm told from people who have recently signed up for their waiting list that the waiting time to see your new doc averages a couple of months, but they have assured me that once you're on the waiting list, they'll make every effort to see you if you have an urgent problem. The United Indian Health Service is the third largest provider of primary care in Humboldt. Their main clinics are the Padawat Village in Arcata, but they also have offices as far north as Smith River and as far east as Wichipec. They will care for members of any federally recognized Indian tribe, not only the tribes of the North Coast, but if somebody from a tribe from elsewhere moves to the area, they're willing to see them regardless of whether or not they have any kind of insurance. And they'll also see the immediate family members of tribal members. The Kama Medical Center in Hupa has essentially the same eligibility requirements as UIHS. The VA has a clinic on Harris Avenue, and they have primary care provided services there. As you would probably expect with any federal program, eligibility is really complicated, and I spent a fair amount of time on the phone because I am a veteran to see if I qualify, but they told me that you really have to go down and either sign up online or speak to them in person to see if you're eligible. Humboldt IPA, or the Independent Practice Association, has a primary care clinic on Harrison, and they will take new patients who have Blue Shield or Blue Cross Anthem HMO plans, which are plans that are offered through CalPERS. They also see patients insured by the Anthem PPO plans, and they also run a clinic at the Blue Lake Casino that's open to employees of Blue Lake Casino and Rancheria members who have their insurance plan. Lastly, of the physician groups, I'll mention the Ikigai Physician Group, which has offices in Fortuna and Arcata. They're what we call a concierge medical practice. What that means is that if you want to be seen in their practice, you have to sign up and pay a fee. They have 3 tier levels. The lowest cost tier is $1,100 a year. The highest cost is $6,000 a year. That's to have the privilege of being a member of their group. And they aren't taking new patients, but they are accepting names to a waiting list. Now, next I'm going to mention 2 primary care sources that people may not think of as primary care, but they actually are. And for special groups, I would suggest that you might want to look into them. The first is the Redwood Coast PACE, which is run by Humboldt Senior Resource Center, which is eligible for people over age 55 who would need nursing home level of care, but have the ability to live in the community with the help of PACE services. The government started these programs many years ago because they said, a lot of people end up in nursing homes who could probably remain at home if we gave them extra services. It would be a lot cheaper to do that. So it saves money for the government, and I think a lot of people would much rather be at home than in a nursing home. Now, if you have Medi-Cal, Medi-Cal will pay the full freight of the PACE program. If you don't have Medi-Cal, you have to pay a monthly fee, which right now is almost $8,000 a month. But that includes all of your primary care, all your specialty care, any hospitalizations, transportation, meals, home care visits. It's the kind of care that we'd all want to have if we needed that level of care. So, I might just suggest that people say, wait a second, I could not possibly afford that. Well, the reality is, if you end up at some point in your life needing that level of care and you end up thinking about moving into assisted senior living, or heaven forbid, needing to go to a nursing home, your nest egg is going to be spent on those services as well. You might as well consider PACE, which would enable you to stay at home. Last but not least, I'm going to mention hospice. And, unfortunately, in my way of thinking, hospice is not often considered by patients to be a primary care source. But if your life expectancy is 6 months or less, they provide comprehensive primary care medical services in addition to other benefits. In order to be eligible for the Medicare hospice benefit package, you have to have Medicare Part A and certified as terminally ill with a life expectancy of 6 months or less. Now, the reality is, everybody listening to me on Zoom, at some point in time, will have a life expectancy of precisely 6 months. But generally, we don't have any idea when that is. And most of us deal with that by denial. But if you're at a point where you know that your life expectancy is less than 6 months, I would suggest don't wait to sign up for hospice. It turns out that people given palliative care not only have higher quality of life at the end of life, but they actually live longer. And so if you are in that situation, take advantage of the benefits as soon as you can. So at this point, I'm going to take a break for questions. Jane, since I can't see hands or the chat, if you could maybe let me know what's up.
Well, so far we don't have any questions in the chat that I see. Am I missing anything? No. You've obviously answered everybody's questions.
Maybe I put them to sleep or overwhelm them.
Oh
Okay.
no, I don't think you've done that.
Okay.
How
Next,
do
I'm going to
you
just,
how do you
okay.
sign up for PACE?
Okay, so if you're interested to know about PACE, call Senior Resource Center, say you want information. They're more than happy to schedule an appointment and look at your case specifically to see whether or not your level of, some people think, well, I'm not ready to be at a nursing home, but if you're having a hard time struggling at home, you may indeed qualify by Medicare regulations to be nursing home eligible. And you need to basically, contact them. And the same thing goes for hospice. Hospice is more than happy to make home visits. They don't require a doctor's visit. And I've had patients ask me, what happens if I last more than 6 months? And I say, we'll give you a party. And, I've had patients last long enough that they've been disenrolled from hospice. Hospice said, you're doing so well, we can't really justify keeping you on our rolls. But, if the situation changes, we're more than happy to take you back.
You do have a question. Sherman and Eva have a comment. What's the comment, Sherman? Please unmute.
I was just going to say CNN yesterday had an article on just getting cancer care in the rural areas that people could look at. It talks about the same kinds of things that you do, but again, it focuses on getting cancer care in rural areas throughout the country.
And a second question. Oh, do you have more to say, Sherman? Sorry.
I was going to say I could put the link where it's not a CNN link that you can read it without having to sign up because I'm not a member. So I can get
That'd be great. Do that. Put it in the chat. Deborah Hartage said, will you be talking about efforts to bring more doctors here?
Yes, I will.
Okay.
Okay, so I'm just going to now have a little change and talk about what if you do have a primary care provider and you want to be seen quickly? Uh, is that at all possible? Let's say you wake up and you're feeling horrible. How can you possibly be seen right away? So I'm going to give you a couple of hints. First of all, you need to find out when the telephone system of your primary care practice goes off of answering service onto their phone line. And you should be ready to call the minute that they open up. Because if you wait for even half an hour, you might find out that the recording says you're 32nd in the queue, which is what I got when I called my primary care provider a couple of weeks ago. Now, if that happens, leave your callback number because you will eventually get called back. I also recommend that you register with your provider's patient portal. Essentially, everybody uses electronic medical records, and they all have a patient portal where you can see your own record. And at least on the Providence patient portal, you can actually schedule an in-person or video visit with your provider or somebody on their team. Now, when I looked last week, the waiting time to schedule an in-person visit with my primary care physician was 2.5 months. So, but at least that's, if you want to wait, you can make your own appointment. If you want to be seen the same day, it's unlikely you're going to see your own physician or provider, but you might see somebody on their team. And at least somebody on the team will have access to your EMR and can communicate with your PCP. If you do have a Providence record and access to my chart, you can actually make a same-day visit with a thing called Express Care Virtual, and you could look at their website for that. Now, this will give you a same-day visit with some provider somewhere in the world, I don't know where they are, between 8 a.m. and 8 p.m., 7 days a week, but the provider on telemedicine will have a California license. They can actually order medication for you, order a laboratory test. If you want to be seen the same day, don't rely on sending a message through the patient portal because that message may not be read for several business days. You can also consider the use of home tests. Let's say you're a woman and you think you might have another urinary tract infection. Well, there are home test strips, and you can see if it's negative, it's unlikely you have a UTI. If it's positive, you may or may not, and you should probably end up getting to the providers one way or another. Same thing goes if you think you might have influenza or COVID. As we know from the epidemic, many of us had our own COVID tests, and they're still available. You could try calling Redwood Urgent Care, which is on 23rd Street, right across the street from Providence Primary Care. They're open from 9 a.m. to 6 p.m. Monday through Saturday, but they're usually so busy that they suggest that you call and make an appointment. So it's not quite the same as in many areas of the country where it seems like there's urgent care in every strip mall. Going to the emergency room is always an option. However, unless it seems to you like a true emergency, I really suggest it's your last resort. Now let's talk a minute about specialty care. What do you do if you feel that you need to see a specialist? Across the board, access to medical and surgical specialists limited in Humboldt County, and waiting times can be long. Most of the specialists in the county are employed by Providence Medical Group, and the good news is they accept all forms of insurance, including Medi-Cal, Medicare, and private insurance. There are specialists out of the area that you might be able to see by a telemedicine visit, avoiding the need to travel. Usually, to see a specialist by telemedicine, you have to first be referred by your primary care provider, whether that be at Open Door, UIHS, Providence Primary Care, or elsewhere. Prior to 2020, Medicare would only pay for face-to-face doctor visits. But then, due to the needs of the COVID pandemic, Medicare started paying for telemedicine visits, but it was going to expire on December 31st of last year. But due to a lot of lobbying by rural communities, they've now extended that. And everybody in Humboldt County, since we're a designated rural area, now has telemedicine benefits through December 31st, 2027. And we're hoping that'll be extended once again. Okay, so here's the details of access to surgical specialists in the last 21 years by specialty. So, even though general surgeons have decreased by 25% and orthopedic surgeons by 36%, I'm told by my colleagues who are still in practice that they feel access to both general and orthopedic surgery is still pretty good. So whether you need a minor procedure like a hernia operation, or if you break your hip, or if you need joint replacement surgery, you can probably see a local general or orthopedic surgeon. 20 years ago, we had a cardiac surgeon here, but that program was closed a year ago at St. Joe's. And so now if you need heart surgery, you have to leave the area. The reality is that the amount of surgery that was being done here was only about 50 cases a year. And it reached a point where it wasn't financially viable. And frankly, it may not have been ideal care to have a surgical team that was not that practiced. Higher volume centers often have better statistics than lower volume centers. I'm going to mention a couple specialties that I think are in dire straits, and that's neurosurgery and urology. 20 years ago, we had 3 or 4 of each one of these specialists. We're now down to 1. And I want to personally thank Dr. Messagey, our local neurosurgeon, and Dr. John Albertini, our local urologist, for hanging in there. Because if they finally say, I just can't take it as the only specialist for 150 miles and leave our community, everyone who needs their care is going to have to go elsewhere. I'm also going to mention ophthalmology, where we used to have 6, we're now down to 2. And once again, I'd like to thank Dr. Greg Gibb and John Mastrioni, who basically held their practice going for longer than I would have expected them to have wanted to retire because of a sense of obligation to our community. So now with only 2 ophthalmologists, it means that if you need cataract surgery, or if you have a detached retina, or if you have macular degeneration and you need injections actually into your eyeball, more likely than not, you'll need to travel elsewhere because our 2 local ophthalmologists just cannot meet the local demand. We mentioned medical specialists. Medical specialists, basically, you can see all the writing there. Cardiology, I'll mention, and you say, well, wait a second, there are 3 cardiologists now, and there were 3 cardiologists 21 years ago. Isn't that okay? Well, you probably don't remember, but in the slide I showed you of primary care physicians, in 2005, we had 22 general internists here. Now we have 4. When I was in practice, I was trained to take care of uncomplicated heart attacks, patients with congestive heart failure, valvular heart disease, atrial fibrillation. But, I should say perhaps many family physicians and probably most advanced practice clinicians, that is nurse practitioners and physician assistants, really don't feel that they've been trained to take care of patients with those cardiologic problems, and they're much more likely to be referring to cardiologists. A year ago, there was up to a 6-month wait for an outpatient referral to see a cardiologist in our community. Providence has been able to alleviate that waiting list dramatically by hiring some locum tenens visiting cardiologists, and have some cardiologists from Providence Medical Group in Santa Rosa come here on a visiting basis, and that wait time is now down to just a month or 2. Gastroenterology, we used to have 3. Now we have 0 after Dr. Kay Stokes finally retired this year after holding out for a long time. Now, the good news, we've been able to maintain colonoscopy availability by having some semi-retired physicians do a lot of colonoscopies. And they've also hired some visiting gastroenterologists to see here. But if somebody has a chronic GI illness like ulcerative colitis, you're probably going to have to get help elsewhere. Medical oncology is another area that is in trouble. We used to have 3 medical oncologists. I'm now listing one because there is one listed in our medical society directory. That's Dr. Richa, who used to be here full time, but he's now moved to the Bay Area and he only comes here 1 week a month. There have been some visiting oncologists here to maintain medical oncology services, but things are really in prior dire straits. And, I'm not going to go over detail for all the other medical specialists, but it's here on my slide that it's hurting in many areas. And if you have any specific questions, I'll have time for that in a minute. Lastly, I'm going to mention psychiatry because I was frankly surprised when we did the tally to be reminded that we actually had 17 practicing psychiatrists here in 2005. We're now down to just 4. Now, this is despite the fact that we are not a mentally healthy county. Our suicide rate of 23 per 100,000 is more than double the California average and among the highest in the nation. Now, the good news is that we're well supplied with non-physician mental health workers, marriage family counselors, licensed clinical social workers, clinical psychologists, people who can offer talk therapy. Our local North Coast Association of Mental Health Professionals has 235 members on their website, which surprised me. That's a lot of them. However, only physicians can prescribe medications for more severe psychiatric disorders such as severe depression, bipolar disorder, and schizophrenia. And with a shortage of psychiatrists, this leaves either primary care physicians or telepsychiatrists as the principal prescribers of psychiatric medications. Our county mental health, which is the only locked psychiatric facility for 150 miles, relies on telehealth psychiatrists, which in my opinion is less than ideal for patients who may already have a tenuous grasp on reality. I guess I'll stop here and see if there are any questions about specialist care.
Well, there are a couple of other questions, actually. Do you want to take? They were from before also.
Sure, yeah, I'll take any questions.
Okay. Caring for an elderly aunt who is 94 and will be 95 in August. She sold her home and living in a care facility that charges approximately $7,000, but her money is soon running out and all she has is Social Security. Would she qualify when funds are deleted? What happens to her?
Okay. What happens, I'll tell you right now, a lot of people think that their Medicare will cover nursing home care. Medicare will pay for nursing home care for 21 days after you've been in the hospital with a qualifying illness. So if you're in the hospital, let's say with a broken hip, you can get 21 days care in nursing home. After then, basically, the bill is yours to pay. And you're expected to pay until there's no more money. And once there's no more money, then you become eligible for Medi-Cal. And at that point, Medi-Cal pays. So if somebody's in an assisted senior living facility and the money runs out, these are private, organizations. And what they will do is they don't kick you out on the street, but they will work to get you a place in one of our local skilled nursing facilities. And once there's no more money, you'll become eligible for Medi-Cal. Medi-Cal will pay for a nursing home. It will not pay for senior living. Next question.
There's a rural cancer article that's listed here. Driving San Francisco and back every something or other. Anyway, Sherman has it listed here that you might be interested in, so take a peek. This may be too early in your talk, but why aren't there more doctors coming to this area at least several years before they retire? Is it money? Thank you for doing this talk.
I can tell you right now, I don't know any physician who comes to this area for money. the reality is Humboldt County, you can look this up yourself, but in terms of our per family income, we are 54th lowest of the 58 counties in California. We are a poor community, and I think everybody here is well aware of that. We have what is known as a poor payer mix, which means that we have relatively few patients who have private medical insurance. Most of our patients here have either Medi-Cal or Medicare, which pay much, much less than private insurance. Why somebody decides late in their career to move here, I think you'll have to ask the individual providers. Maybe they've made enough money living elsewhere and they now feel that they can donate services. I don't know. I would ask them myself. But it's not because they want to make money. I'm sure of that.
There was a question about the specialty of gastroenterology.
Okay, so we had 3 gastroenterologists here 21 years ago. We now have none. Providence Primary Care has hired a locum tenens gastroenterologist who's here currently. And as I mentioned, there also are surgeons that have been trained to do colonoscopies that are doing colonoscopies as well as upper GI endoscopies. But if you have a chronic gastroenterologic illness or you need a consultation, it's either going to be a long wait or traveling.
What about dermatologists?
Dermatologists, we have a dermatology practice that has offices in both McKinleyville up by the airport and also down in Ferndale and Fortuna. They have hired a number of advanced practice clinicians in their practice as well, and they actually do not require a physician's referral to be seen. So you can call and ask to be seen for a dermatologic thing. They have two physician dermatologists and a number of nurse practitioners or PAs.
What if your doctor doesn't have hospital admitting privileges?
Well, if your doctor doesn't have hospital admitting privileges, you can't be admitted to the hospital by that physician. If the physician could refer you to another physician, I suppose, who has hospital admitting privileges, or in an emergency, you go to the emergency room and they'll have to find somebody for you or arrange for transfer out of the community.
And who are the neurologists in Humboldt County, please? And thank you.
Dr. Melissa McKenzie and Don Iverson, and they have my heartfelt appreciation for remaining, because if patients have, a chronic neurologic condition, be multiple sclerosis, Parkinson's disease, or whatever, or if you just need a neurologic consultation, they are still here. There's clearly a waiting list, but if you have a primary care provider, they can refer you, and they tell me that they do prioritize the consultation requests that they receive.
Okay. Really, Jerry Ruman says, really appreciated the research you did about healthcare here. So valuable. There are efforts being made to get more physicians here. We have a family practice residency. Stanford and UC Davis med students do rotations here. There are several local folks who grew up here and came back as physicians. And there is a program for local Native Americans to get support to attend med school. There's also a pre-med program at Cal Poly Humboldt where pre-med students get paid in the summer to shadow local physicians. These are all great programs. Thank you, Jerry.
And I want to thank Dr. Rubin for joining in. She certainly knows the situation. She's one of those 17 psychiatrists who are no longer here. But she deserves a retirement, as I hope I do, after practicing here for 40 years.
Thank you so much. Valuable information. And then what is your assessment of the larger factors at play for these downward trends?
Oh man, that's so complicated. That's another OLLI talk in and of itself. So, let me just finish what I have here about the situation locally, and then we can talk about why, as a society, what has changed that has made access to healthcare so difficult and so expensive. I think it's really a tragedy that we have the most expensive healthcare system in the world, but not the number one quality healthcare system in the world. But moving on to some good news. What if you actually have a real emergency? And we do have news because at a time when many rural hospitals in the nation have had to close their door, in Humboldt County, the 4 hospitals we have, everywhere from Phelps Hospital down in Garberville up to Manitoba Hospital in the north, still are open with 24-hour emergency coverage. If you have a true emergency, I would tell you, do not hesitate to call 911. If you have major trauma, a heart attack or stroke, minutes may make the difference between life or death. The EMTs in our emergency response network are trained to quickly triage patients, provide life-saving care, and transport you to the facility that has the best ability to care for you. They can communicate with ER physicians to coordinate rapid response, so the emergency room is ready when you arrive. Providence St. Joseph Hospital, back 48 years ago when I arrived, was just one of, this basically had the same level of service as the other hospitals in the area, but has now become really the regional medical center to our county. It's what we call a STEMI receiving hospital. STEMI stands for ST segment elevated myocardial infarction. These are the worst of the heart attacks, the widow makers, if you will. And they pay to have an invasive cardiologist and a cath lab team on call 24/7, 365. The metric that they're measured against is what we call the door to balloon time. That is from the minute that you roll in the emergency room door to when you're in the cath lab and they open up that coronary artery with an angioplasty catheter. 90 minutes is what the goal is, because that is what you need to save heart muscle. We have a level 3 trauma center. So whether you end up being involved in a major automobile accident or falling off a ladder, there's what we call the golden hour, which is that first 60 minutes after trauma, which can make the difference between life or death. St. Joe's has level 3 trauma care certification, meaning that they always have general and orthopedic surgeons on call to care for those emergencies. What's new this past year is primary stroke certification. And I really give credit here to Dr. Melissa McKenzie, our local neurologist who spearheaded this. They actually have now national certification for a stroke care center. The metric they have is that 30 minutes from when you enter the emergency room to when you have your CT scan done and read by a teleneurologist to basically initiate treatment to save brain function. Although it may not affect anybody listening to the talk for OLLI, we may have grandkids that may benefit from the level 2 neonatal ICU. They always have a pediatrician on call with trained neonatal nurses to care for newborns needing life-saving therapy. As Dr. Rubin mentioned, for the last 7 years, we've had a family medicine residency program in partnership with Open Door Clinic, which accepts 7 medical school graduates annually for a 3-year residency training program. And of our first 4 graduating classes, just short of 50% of the residents have ended up staying here. We also have the cancer care has been mentioned. So the good news is we actually have a comprehensive cancer center here with the tumor board that meets weekly to coordinate cancer treatments among surgeons, radiation therapists, and medical oncologists, as well as palliative care specialists. So these are all good things for our community. So the people say, well, what does the future of medical care in Humboldt look like? And I think of the quote attributed to Niels Bohr, the famous physicist that prediction is very difficult, especially if it's about the future. Now, I know he wasn't talking about healthcare at Humboldt. I think he was talking about Heisenberg uncertainty principle here. But the truth of the matter is, I don't know what the future is going to be like here. And AI is a big, gigantic question mark over everything in our lives. And that's probably at least several OLLI talks we can spend. But I'll have to say that in the short term, I don't expect any substantial change in the problems with the availability. There's a national shortage of physicians in general and primary care specifically, especially in rural communities being the most affected. HR1, or the so-called Big Beautiful Bill, is going to have a devastating effect on medical care in general, but especially rural care, because it is going to drastically cut eligibility for people with Medi-Cal. And although Medi-Cal may not pay nearly as well as private insurance, it's what essentially our local providers, the hospitals and the physicians' practices, need to stay afloat. There's also been cuts in the last year in the Affordable Care Act, which many people now see the bills for their Obamacare plans going up so much that they've just dropped their insurance. And when they get sick, they're going to defer care till when they finally have to get care. And at that point, they're going to be even sicker and they're going to require even more care. When somebody comes to the emergency room, the hospitals can't turn people away because they can't pay. They must take care of them. And if they need to be admitted, they need to be admitted. That will end up to unreimbursed care, and people will end up being having medical bankruptcy. And the local clinics and hospitals may need to reduce services due to budgetary constraints. You know, our main local providers of medical care, be it Providence St. Joseph or Open Door Clinic or UIHS, are non-for-profit organizations, but that doesn't mean that they can operate at a loss. You know, they still have to pay their nursing staff, they still have to pay their electric bill, and if their income is dropping, they're going to have to cut back somewhere. So what can you do to improve the situation? Well, tell our elected representatives that problems with lack of access to medical care is a top priority for you. And I know what you're going to say is that, well, I know that Jared Huffman and our supervisor, Nancy Arroyo, already know what the problems are, which is true, but let them know specifically that this is a top issue for you. Support our local medical facilities when you choose where to seek care. You know, when you're traveling outside the area for specialty care, sometimes you do it because it's not available locally. But the reality is sometimes specialty care is available locally. And if you leave the area to see a specialist outside the area, you're essentially taking dollars that might be supporting our local healthcare delivery system and spending them elsewhere. There was a time when there were no orthopedic surgeons in our community trained to do joint replacement surgery. And I know many of my patients left the area to get their new knees. But the reality is that we now have an orthopedic surgeon, Holly Height, who has done after her orthopedic surgery residency, she did a fellowship at Stanford in joint replacement surgery. Eric McGoldrick, after his orthopedic surgery residency, did a fellowship at University of Washington to become a shoulder specialist and does shoulder replacement surgery. So when you leave the area to have your replacement joints, you're basically taking dollars out of our local health facilities when excellent care is available. This past year, when I had a slip disc and I needed back surgery, I saw Dr. Jamie Messagey and had my surgery done at St. Joseph. I could have gone elsewhere, but I knew that I could get good quality care here, and I was very pleased with the same-day surgery that I received. So I would urge you, take advantage of our local facilities when we have quality care here. And if you're unsure if there is quality care, ask your primary care provider. See what they have to say. Also, if you have the financial ability, support our local non-for-profit medical facilities and by donating money. You know, tax time is around the corner, and I think all of us with retirement funds understand the minimum required distributions that we have to take out of those tax deferred accounts and end up paying taxes on that money that's been deferred for all that time. Well, guess what? If you give the money directly to a non-for-profit organization, you don't have to pay taxes on that money. So if you don't need that money to live on, if you're if you're fortunate enough not to, consider supporting our local facilities. Providence Medical Foundation has a special fund called Destination Humboldt, which is money is then earmarked to support recruiting providers into our area, perhaps paying off student loans, perhaps paying relocation or signing bonuses. Open Door Community Health Centers, if you look at their website, that has a Donate Now button at the top of their webpage. If that's your provider, consider contributing to them. Humboldt Senior Resource Center, which runs the PACE program, relies on community support for many services to our older population. And last but not least, be nice to your doctor. Retention of physicians who have been recruited to our community is as much of an issue as recruiting them here in the first place. It's especially disappointing when somebody has been recruited to our area, they stay for a couple of years, and then they leave. A frequent complaint of physicians who leave the area is that it's hard to practice here because of the lack of specialists to refer to, and then patients blame them for problems with access to care. And we know that it's frustrating when you've waited a long time to see your doctor and then only get 15 minutes to discuss your problems. But it's not their fault. So I would urge you, when you do see your doctor, prioritize your issues to discuss at any single visit. Start with the problems that are most important first. So if you run out of time on that 15 minutes, you don't end up with what I call a Columbo moment. I can't tell you the number of times when I was in practice when I'd have my 15 minutes with a patient and we'd talk about their blood pressure and their knee pain and their skin rash. And then I'd have one hand on the door. Now, I think a lot of you remember that old detective series with Peter Falk as Columbo. It was this rumpled detective, and he'd be talking to a suspect, and then he'd have one hand on the doorknob, and he'd turn around and say, by the way, and he'd ask one last question that would crack open the case. Well, my Columbo moments was when I was ready to leave the examining room and the patient would say, by the way, doc, I want to talk to you about this chest pain I've been having. And I say, oh my goodness, not only is that going to have an issue because now I've not spent that first 15 minutes on the most important problem that we really should be talking about, but it means every patient for the rest of that morning or afternoon session is going to be that much later because I've been delayed. Understand that your PCP is probably even more frustrated with the system than you are because they're dealing with it all day long. And as I said, no young physician decides to go into primary care and then moves to a poor rural community to get rich. Your doctor, your primary care providers, whether they're doctors or nurse practitioners or physician assistants, they're idealistic and they're making a financial sacrifice just to be here. A simple thank you can go a long way to improve their job satisfaction and desire to stay here. So that's the end of my prepared things. I'll open up for questions again.
Okay. Thank you ever so much. That was great. What about the national nursing shortage?
What about it? There is a national nursing shortage. I agree. That wasn't the topic I was asked to address here. I will say that I was very sad. For many years, College of the Redwoods has had a nursing program for the 48 years that I've been here, where nurses get an AA degree. And when I first arrived here, HSU, now CPH, had a 4-year program where nurses would get a BSN. Then about 10, 15 years ago, I guess, HSU dropped their RN program, and I guess you better ask them why they dropped it. I understand it was for financial reasons. Well, they're now partnering with CR, where nurses can get an AA degree here and then can get to work, make real money, and can part-time get their BSN degree, which enables them to do certain specialized nurses functions the nurses with an AA can't get to do. So, we've taken to basically trying to grow our own here, if you will. I also mentioned here that CR is now in the process of expanding a number of health career training programs. So they expect in the next few years to have training programs for respiratory therapists, X-ray technicians, and OR technicians as well. These are all really good paying jobs that only require 2 or 3 years of formal education that hopefully some local high school graduates will go through the training and stay here. So there's a nationwide nursing shortage, I agree, and I don't know what else to say about it. Thanks.
Are there services that St. Joe won't provide for religious reasons?
Oh, yeah,
And
absolutely.
also the status of palliative care.
Okay, so first question, everybody who lives here understands that St. Joe's is a Catholic institution. They are governed by the bishop's directives. And, I'll say personally, I'm not Catholic and I disagree with their stance on women's reproductive rights. But, the owners of that facility are actually the Sisters of St. Joseph Orange. There are not many sisters left in the order, less than 70, I understand, and their average age is over 70. I have to say that I've met a number of the sisters. There used to be a sister who was physically present when at all times when I moved here. They're no longer sisters who actually live in Humboldt County. I share their values, other than for women's reproductive rights. The truth of the matter is that I don't know any other healthcare organization in this country that is eager to take over an isolated rural hospital. It's not a formula to make any money. If St. Joseph Hospital, if Providence, now Providence St. Joseph, were to throw up its arms and say, we're out of here, I don't know who would take over a hospital. Although many people may wish that we had different ownership, I just don't see it happening. Kaiser is not interested in moving into a community unless they have a certain number of paid subscribers where they can run their own hospital. And they figure they need at least 100,000 members to make that cost beneficial. Well, we're never going to have 100,000 people with good paying jobs getting Kaiser insurance in Humboldt County, not in my lifetime anyway. So that's about Catholic healthcare. Were there other questions as well
Yeah.
tied to that? Yeah.
The status of palliative care.
Palliative care. So palliative care services, ironically, we have one more palliative care physician here than we had even a year ago. And the reason is that St. Joe's was forced to close the rehab unit, which had been physically present in General Hospital, in order to comply with California seismic safety regulations. After the Loma Prieta earthquake in the 1990s, the state increased seismic safety rules for hospitals and gave hospitals a 25-year window to come into compliance. And the reality is General Hospital was never going to come into compliance, so it would have to be torn down and rebuilt. And St. Joe's could not find the money to build a rehab facility elsewhere. So they ended up sadly closing our acute rehab unit. But the good news is that Charlie Knoll, who is a physiatrist, you may not be familiar with that term, physiatrists are specialists in rehabilitation medicine, who had been our local rehab doctor, wanted to stay in the community. And when there was an opening for a new medical director of hospice, he took that job. And although it might seem a little different in focus than rehab medicine, both specialties deal with quality of life. And he's actually taking an online program to become certified as a palliative medical specialist. There's a palliative care program through our local hospice organization, which is different than the hospice program itself. So if you're interested in palliative care services, I would really recommend that you give Hospice of Humboldt a call, and I'm sure they're more than happy to answer questions about their palliative care program. Another question?
Will there be a written copy of your talk? There's a lot to unpack. Excellent information.
I don't, Jane, is there
Now,
any
this will
way?
be recorded on YouTube. If you wish to share your slide pack,
Yeah,
you can send it to me or to OLLI, and people can request it.
okay, I'll send it to you, Jane, because I know your email address, and you can figure out how to share it elsewhere. That's fine.
Yeah, this talk will be available on YouTube as part of the archive. That is located www.youtube.com at Ollie Humboldt. That's how you get access to it. Okay. I've typed up any health issues I am seeing the doctor about and also any questions I have for them. They can look at my items even before they come into the room, and I have a list also. This is just a suggestion.
I
That's
think that
Katerina.
I was saying that's a great suggestion. Write down your questions, because otherwise, what happens is you end up leaving the office and saying, "Oh my goodness, I forgot to ask that
Yeah.
question." So make a list, prioritize the list. Another thing I'll say is, please bring in all your medicines. Okay, I know that all of your medicine list is on the computer. We hope it's accurate. Sometimes it is, sometimes it isn't. But I would tell my patients, go to your medicine cabinet, get a brown paper bag, put everything in the bag, including all your over-the-counter medicines. And when you're put into the examining room by the medical assistant, take out your bag and line everything up on the counter. And have the medical assistant go down and make sure that what's in the computer is actually what you have at home. Because the reality is, what's in the computer may or may not be what you actually have. And that's so vitally important to get everything as accurate as possible.
Good idea. John Clark said, we moved here from Tulsa 2 years ago. The medical care in Humboldt is good and the support staff is efficient and friendly. Ditto, Dr. Iverson brought my seizures to a stop. There's another, let's see. I have unfortunately had to use of the emergency room, great emergency department at St. Joe's more than once, brought to it by ambulance and by myself. Saved more than once. Excellent care. Well, we're glad you're still around, Peter. I
Yes.
enjoy seeing you. Dr. Iverson, my neurologist, is the best and keeps my tremors under control. Let's see. What did I miss here? I think that's all the questions unless somebody wants to unmute themselves and ask one.
Well, thanks everybody for listening. I know I tried to squeeze too much information into that slide set, but I hope I was able to answer many of your questions. We certainly have a lot of problems here, but there's also some reasons for hope. I know it's not much solace to say, well, there are other communities that are worse off than we are. But, I stayed here because it's a great place to live. And I think we all agree with that, or you wouldn't be here in the first place. And hopefully we're going to get a new young group of physicians to agree with us and decide to lay down roots and stay here for their careers. So thank you all.
I just saw something that I hadn't seen before. Apparently, if you scroll down and click transcript, a transcript will appear on the right side of the screen. And then you can apparently do something with that.
Oh
Now,
my goodness.
I
That's
had no
AI and
idea.
that's
That's
kind of
the first
scary, but
time
I guess
I've
it's
heard
available.
that.
Well, thank
Um,
you for the talk.
Thank you
Thank
for the
you.
well organized talk.
Thank you
Um,
so much.
and let's see, many, many thank yous, your direction.
Okay,
That's
thanks
what
for
those
listening.
rising hearts are all about. We thank you very much for taking the time. And if there's something, I still have one spot in the summer program, OLLI program, if you want to attack another aspect of this, Dr. Kessler.
Okay, I think I need to rest up from preparing this talk first, but I'll keep it in mind.
Okay, thank you ever so much for volunteering to do this. This was magnificent, and we appreciate everything you do for the community and have done. Thanks for listening. Oh,
Okay,
by the
thank
way,
you.
I forgot to mention next week. We have something going on next week. I'd better open up and talk to you about it. It's the future of local media and the role of the Lost Coast Outpost by Hank Sims. He's editor of the Lost Coast Outpost. So feel free to come back on April 6th. And we look forward to seeing you again. And thank you for supporting OLLI. And if you are not getting an invitation to these talks, you can call OLLI and say, please send me the invitation every week. If you get the newsletter every week, there is a presentation of this invitation and the link. But if you don't want to do that, you can contact OLLI and say, please send me the invitation, and we will respond. Hey guys, have a wonderful time. Spring is springing. Allergies are springing. Have a great time. We'll see you next week. Take care.